So you brush your teeth, you floss, maybe sometimes, and everything feels fine. But what if your gums were already inflamed and you just couldn't tell? So what I'm going to do in this video is I'm going to show you 5 early signs of gingivitis that almost no one catches until it's gotten worse. And these signs are subtle, but once you learn how to spot them, you'll never unsee them. And they could actually save you from serious dental work later on. Now, before we dive in, let's define what gingivitis actually is. So gingivitis is the earliest stage of gum disease, and that happens when plaque, which is a sticky film of bacteria, forms along the gum line and triggers an inflammation. And your body responds to this by sending more blood flow to the area, trying to fight it off. And while that's happening, your gums begin to change. In most ways, people don't even realize. Oh, and by the way, I'm a dentist and I'm here to help you understand dental health the easy way so you don't have to learn it the hard way in the chair. So, what makes gingivitis tricky is that it often starts silently, and you might feel perfectly fine, no pain, no swelling, no obvious symptom, yet under the surface, the inflammation is beginning. And this is why these early signs matter. And it's completely reversible if it's caught early, but if it's left untreated, gingivitis can progress into something more serious known as periodontitis, and that involves bone loss and gum recession that may never fully heal. So the earlier you spot these warning signs, the better. So let's start with the first one. The first sign, and maybe the easiest one to brush off, is bleeding. So you see a bit of red in the sink when you brush, or maybe the floss comes out with a tiny streak of blood. And most people assume they brush too hard or that flossing just does that. But the reality is healthy gums do not bleed, and they should not bleed, not even a little. But because it doesn't hurt, doesn't feel harmless, you move on. And then you start flossing less, and because it feels uncomfortable and that bleeding gets worse over time, therefore you never end up fixing the actual problem, which is inflammation and infection around the gum line. Now, even a drop of blood means that your body is fighting off something, and that fighting is happening under your gums. And it may look minor, but bleeding is one of the clearest signs that gingivitis is setting in. And even if your gums bleed consistently, whether it's once a day or once a week, it's a red flag, because you may think, I just need to use a softer brush, but in reality, you actually need to clean more thoroughly, because plaque is sticky, and once that starts to set in, it turns into tartar, and that can only be removed professionally. And here's something even more surprising. Bleeding gums don't just affect your mouth. There's growing evidence that inflammation in the gums is linked with cardiovascular disease, diabetes, and even Alzheimer's. And the second thing here is persistent bad breath. So everyone has bad breath, sometimes to some degree. But if it sticks around, especially after brushing, flossing, or using a mouthwash, then it's time to pay attention. And this kind of bad breath doesn't come from coffee or garlic, it comes from bacteria hiding under the gum line. And what these bacteria do is they release gases, something known as volatile sulfur compounds. And they smell terrible, and they can't be masked with gum or mint. And this smell is coming deeper from your mouth in areas you can't reach with a toothbrush. And therefore, persistent bad breath, especially in the morning or later in the day, is your body's way of saying there's an infection happening here. And gingivitis can be completely painless, but bad breath is often the earliest clue that something has changed. And the smell may not be strong enough that you notice it while talking or wearing a mask. And it's not just a cosmetic issue yet. It's usually a biological sign at this point, and your body is trying to flush out toxins from that bacterial buildup. And it's known as halitosis in dentistry, and it's one of the first signs that your oral microbiome is out of balance. Now, before we get into the next signs, if you're wondering why all of this is happening, I break this down in the next video. What causes gingivitis? So you'll learn how plaque forms, how it turns into tartar, and how your immune system actually responds to it. And brushing is just one piece of the puzzle. But keep watching to the end, because the next signs are actually even easier to miss. And the third thing here is changes in gum color and texture. So healthy gums are supposed to be firm and pale pink and snug around your teeth. And when gingivitis happens, you'll often see a change in color and texture, but it happens gradually. But it's easy to miss unless you're really looking. And your gums may appear slightly red, they may look shiny, smooth, little swollen, instead of firm and matte. And these changes are early signs of inflammation, even if they don't hurt. And then maybe over time, they might start to feel a bit more fragile, they may bleed more easily, or they might start looking a bit puffier in certain areas. And therefore, your gums start to look a little different. Even if you feel fine, it's worth paying attention to. Now, a habit I usually do, and I suggest you also do that, is I check my gums under natural light once a week. I look for any asymmetry, maybe swelling, or any dullness around the front or side teeth. And also, if your gums no longer feel flat or flush to the tooth, or the color has even shifted a little, your body may be in early stages of inflammation. And the fourth thing here to look out for is gum sensitivity or tenderness. And this is usually overlooked because it's not dramatic, it's not painful, there's no swelling, it's usually just mild tenderness. And it's the kind that creeps up every now and then, slowly sticks around without it being obvious. And you might feel it maybe when you're eating something crunchy, or maybe when you drink some cold. And maybe even when you're brushing along the gum line and you notice one particular tooth as well, and it's not unbearable, but it's noticeable. And it's not the kind that hurts like a cavity or a cracked tooth, and most people write it off thinking maybe I just brushed too hard. And then to avoid the discomfort, they may brush more gently next time around that area, or they might skip it altogether, and then plaque starts to accumulate, and then that starts to build up, and then that causes tartar, and then that causes an inflammation, and then the tenderness spreads, and the cycle continues. Now, one way to test this is to trace your gum line with your toothbrush bristles, and if one area feels a little more tender than the rest, even a little, take note, because it could be early signs of gingivitis. And also watch out for sensitivity that gets worse when you eat something citrus, maybe spicy foods or sour snacks. And if the discomfort is localized and keeps coming back, then it's usually time to investigate. And the fifth sign, which is the most visual and in many ways the most concerning, is changes to your gum line. So what I mean here is if you notice things like puffiness or swelling around an area, or gums that look pillowy or rounded around the tooth, or gums that are pulling away from a tooth, which is what we call recession, or a feeling like your tooth looks longer. But these changes happen slowly, usually over weeks or over months. So unless you're paying attention, you probably won't notice this until it's advanced. And then you start noticing maybe food getting stuck there more often, maybe cold sensitivity when it hits the root surface, or maybe your teeth start to look a bit uneven in photos, and you might think why all of this is happening. And therefore, what I suggest is you check your gum line regularly, just like checking your skin or your posture. It's one of the best habits you can build. In this case, what I suggest is using something I call the mirror smile test. So smile in the mirror and take a photo once a month and compare. So if one side looks puffier than the other, or looks longer, your gums might be shifting. And also make sure you pay close attention to flossing, because if you feel a dip between the tooth and gum, or if the floss suddenly slides deeper in one area than the others, that's usually a pocket forming. And that's an early sign of periodontitis starting to take over. And so even though this sign is the last on the list, it's the one that pushes people to take action the most. Now, these signs may seem small on their own, but together they tell a much bigger story, one that often goes completely unnoticed until it's too late. And in this next video, we're going to look at the causes of why all of this happens in the first place. And thank you for watching.